Hello and welcome to In Touch with Durham County, the show designed to provide you with information about Durham County government people, programs, and services. I'm your host, Deborah Craig Ray. We are pleased to bring you another exciting show today. Krystal Harris is Director of Community Intervention and Support Services. She joins us today to talk about CISS and the evolution of this critical community-facing work. I'm looking forward to an exciting conversation. Seth Komansky is Durham County's newest Chief EMS paramedic. In our second segment, we'll hear from Seth, whose career spans emergency medical services, homeland security, and intelligence coordination. His depth of experience as a public safety leader offers a valuable perspective on how communities prepare and respond to critical incidents. We are fortunate to have him with us today. Well, hello, Krystal. Welcome to the show. I think this is your first time joining us.
It is. I'm happy to be here. Thank you.
Well, we're glad you could make time for us today.
Yes.
Okay, so for those who don't know you, tell us a little bit about your evolution here at Durham. And I'll say that you've actually been here in one capacity. You left, spread your wings a little bit, and then you came back.
Yes, it's actually my third time
working
for Durham County. I actually started in 2005, I believe it was, as an income maintenance caseworker at Department of Social Services. I stayed about 5 years, worked in several different, areas at DSS, and then I left, kind of just took a leap, went into working for a dual diagnosis clinic for the state with mental health and substance abuse. And then I moved back here, started again in a different area. And that next leap was huge because I left from being a supervisor here in Asian Adult Services at DSS and went to become the DSS director in Vance County. Mm-hmm. And so was there for about 2 years and decided to come back home yet again. And I was assistant director at our social services. And for the last 4 years, I've been the inaugural director for community intervention and support services.
Yeah, and so that is important. You're
yes,
the inaugural.
I am.
And so for those who may be unfamiliar, please tell us what community intervention and support services does in Durham County.
So what we do is we help support kind of like violence reduction efforts. We do house our Project Build program, which is a joint city-county program that services 10 to 21-year-olds around prevention and intervention of gang violence. Mm-hmm. We also do a lot of community engagement with our Durham Public Schools. We're trying to expand into more community neighborhoods, but we recently added on prevention to our program as well as aftercare. So any youth that has successfully completed our program, our aftercare will follow them for like the next 6 to 9 months just to kind of support them, making sure that the things that they learn within our program are able to sustain them and become self-sufficient.
So it's kind of wraparound.
It is kind of wraparound, yes.
Mm-hmm. So what inspired you to personally pursue work in community intervention, given your background?
So I felt like I'd done kind of everything in the social services world, and I wanted to do something different. And this opportunity just kind of fell in my lap. I reached out to she was general manager Pierce at the time, just to kind of talk to her about her transition from public health and moving into local government and administration. And out of that conversation, she was like, well, I have a director position open and this is what we do. And I was like, I really want to get back to community, want to get back to working with, direct practice type of things. And so I looked at the job description on Friday, it closed on Monday. And so I submitted my application and here I am. And so just being able to use social work and my background in mental health and substance abuse and just transition it over into community intervention, it's opened my eyes to so much of what I could do and can do. And so just being back in the community was really the driving force for me to make that transition.
Mm-hmm. Very good. Very good. So just talk a little bit about how the role has evolved over the time period that you've stepped in to lead it.
Gotcha. So of course, like I said, I'm the first director, only director, and the department itself was new when I was hired. And so the first few months was kind of standing up the department because it was just me and I had two programs. And so just kind of restarting the third program, which was the My Brother's Keeper program. And so just building the capacity within the program, actually expanding some of the things we do. And of course, currently I'm working with the city on a joint violence reduction plan. And so it's not just kind of being the director and managing the program, but also doing a lot of community engagement, working through policy, some advocacy work. So all the components of social work that they teach us, I'm able to use that now in this role. So kind of just expanding what the department looks like and what we're able to offer.
So, what would you say would be the most urgent challenge facing these communities right now?
I think the most urgent thing is gun violence right now, especially with our youth. Nationally, what you see is that, once a lot of cities look at their data, they see that it's usually like kind of 35 to 50-year-olds are actually, most of their gun violence is. Here in Durham, it's our youth. And so with being, having a youth program, just wanting to pour more into what does that look like on the prevention side. And so I have been appointed to the governor's gang task prevention intervention task force, as well as the North Carolina Office of Violence Prevention Advisory Board. And so just working at a state level to kind of see what we can do that can trickle down into the counties is where I feel like we're going to find some resolution. But the challenge is just pouring into our youth and finding what we can do on the prevention side.
And certainly, congratulations to you on those appointments, because people are recognizing your talent and your ability to really make a change in this important work.
Yes, thank you.
Yeah. So, are there any shifts in community needs that have emerged over the last few years?
I think so. A couple of years ago, there started with the social determinants of health, and we're looking at that as kind of like high level. But what I found with talking and working with our youth, they're looking at like food insecurity as young people. Some of them can't even do their laundry to be able to go to school. So just kind of identifying some of the basic needs are not being met in our community, and the youth are the ones that are advocating for it, because that's who we talk to most of the time. It's not the parents that are saying, hey, this is what we need. The youth are actually coming to us saying, hey, these are some things that our family needs right now. And so just trying to see how can we fill those gaps for these different things. Also workforce. Our youths are wanting to do something else. They're wanting to work during the summer. They're wanting to get some jobs when they graduate. So just working to partner with some of our local businesses to see if we can do any type of internships, any type of, if they'll hire some of our youth. So just connecting them to those things. So just filling in those gaps and seeing what our youth actually need and listening to them.
And certainly they will tell you what they need.
Yes, they will. If we listen, they'll tell us.
Yeah. So how does your department gather community feedback to stay informed and find out what the issues are?
So our department actually had created a survey that we sent out to our parents, our youth, as well as those that used to be in our program. Just kind of talking high level about the program itself, but also what worked, what didn't work. So taking a start, stop, continue approach. What are some things we need to start doing, stop doing, and continue doing? With the work I'm doing with the city on the violence reduction plan, we've hosted over 15 community sessions, listening sessions. And so just hearing from community as to what has worked well in the past, what they're seeing as their needs are for them to feel safe in their neighborhoods. Project Bill actually hosted a youth session a couple of weeks ago, as well as we had a session with Durham Public Schools with their vice principals, and support staff. So just taking those opportunities to be in community and actually listening and hearing, and not always doing a survey, because some people don't have that time. We say it's only going to take you 5 minutes, but can I really say what I need to say in 5 minutes? So actually just going out and having those spaces and creating space for people.
Yeah, and certainly community engagement is very important.
Yes.
So what partnerships play a critical role in your work? You talked about the city, but do you have others, local or regional partnerships?
We do. As far as with our department, we work closely with Department of Juvenile Justice. We work with Justice Services, which is a part of Durham Department, as well as Department of Social Services. Durham Public Schools is a huge partner with us. We also partner with other youth programs like the Proud Program, Graced Inc. We have a juvenile crime prevention council, and so a lot of the programs that receive that funding, we kind of connect and work with them as well. Part of our program is to link youth to pro-social activities. So we also work with local, the Bull City Woodshop, for our youth to be able to learn how to do those types of skills. We also work with a local bakery. So they provide baking classes to our youth. So we try to partner with whoever wants to partner with us, but also that can give those kind of skills to our youth that they could use outside of school in their home, or if they want to go and take it to, as a skill to go get a job. That's what we try to provide.
So I think you kind of talked about this a little bit. You mentioned the nonprofits that we work with, and how do you work with the health department and even law enforcement?
So with public health, they bring a lot to the table. We work with them around ACEs training and assessments. They also do kind of like the some of the nutritional things around cooking as well. We also have one of our program managers sits on the firearm prevention subcommittee to talk about safe storage. And then when you're talking about statewide, we have a lot of state partners, but going back to local, we have the Duke Violence Reduction hospital program. We work with them as well.
Yeah, I'm familiar with that.
They see gun victims right at bedside, so we kind of coordinate some referrals with them. At the state level, we work with anybody that is in the same space. So we have partners from Buncombe County all the way down to Wilmington. And so just sharing kind of what's working there, what are you doing that might be different, might be, innovative that we could potentially do here. My group just actually went to Asheboro for Randolph County has a prevention program. And so just going to visit, doing a site visit to see what can we do to enhance the work that we're doing here in Durham.
Excellent, excellent. So what upcoming initiatives should residents keep an eye out for?
So, as I stated, we're working with the city on this joint violence reduction plan. We have hosted several community sessions. We will continue to host some. I know we have one coming up with Durham Housing Authority residents. We're also having some with Office of Survivor Care to talk to some survivors of gun violence. And then ultimately it culminates into a joint violence reduction summit that will be held in June next month that will bring together stakeholders. We're working with the Violence Reduction Center in University of Maryland, as well as with University of Pennsylvania. They are just helping us kind of look at our data, look at specifically to Durham, to help us kind of identify where are our areas that we need to focus on, who are the people we need to kind of focus on. And then we'll talk about the different strategies that we can implement. And so that's where community will be a part of that. And so it's kind of like the work doesn't stop at the summit. There's going to be so much more to do after that. And so just wanting everyone to kind of trust this process, be a part of the process. And then once we have identified our strategies, just continue to work with us to build it out.
Well, this is great. I know you're doing wonderful work. Tell our people how they can get in touch with you if they have questions or want to get more information.
So we do have we're part of the website, the Durham County website. If you just go to Community Intervention and Support Services on that site under departments, you'll see us, you'll see Project Build. You'll also find if you have a youth that you're interested in referring to Project Build, the link to the referral is on that page as well. And soon we will be linking the violence reduction page that the city has so that you can also just go from our page to get to that. And that will house all of our community sessions, all of the schedules that you have on what we're doing on that plan.
Well, this has been a great conversation. I really am impressed by all the work that you and your team do, because your team isn't very big, is it?
It is not. My department's only 15.
Right.
So we're small but mighty. Yes.
Yeah, well, continue to do good work for us. And again, thank you so much for your time today. And we're going to have you back to have more of this conversation.
Thank you for having me. I've enjoyed it so much. Thank
Absolutely.
you. Yeah.
Well, we're going to take a brief break. And when we come back, we're going to speak with our Chief EMS Paramedic, Seth Komansky. Stay with us. We'll see you on the other side of these announcements.
My name is Jenna Bajwa, and I'm a paramedic with Durham County EMS. Our ambulances respond to calls from non-emergencies to advanced life support calls. The variety keeps me on my toes, and there are so many things you just don't see in other counties. The police and fire departments are integral to the overall EMS system. This partnership is vital to the success of all of our calls. I'm from Durham. I moved away for a little bit, and now with my job, I feel like I'm at home. It's who I am. I like how it's not all emergencies, it's patient care, it's public service, it's taking care of the truck, it's always being ready, it's face-to-face contact. Patient care is public service, and that's important to me. We get so much experience handling such a wide variety of situations that 2 years in Durham might equal 10 years somewhere else. Durham EMS is the right place for me. I can't imagine being anywhere else.
The heart of Durham, we keep it beating.
Welcome back to In Touch. It's my pleasure to welcome to the show Durham County Chief Paramedic Seth Komansky. Hi, Seth. Thank you for joining us today.
Hi, thanks for having me. It's great to be here.
Yeah. I'm looking forward to a great conversation.
Absolutely.
Yeah. So in my intro, I shared what an impressive background you have that you have brought to this position as chief paramedic. Can you share some of your journey and what brought you here to our EMS position?
Sure. Yeah, no, I appreciate that. So public safety has always been where I've been at. And in some capacity for the past 25 years, it's been, whether it's been the fire service or some sort of homeland security or intelligence work or business continuity and resilience. But the focus has always been at the center, EMS. Mm-hmm. I've been a paramedic that entire time and have worked on an ambulance for that entire duration. And so EMS has always been the home that I've gone back to. And so I've been through the years working in this area in North Carolina since about 2008 and in neighboring counties. And so I've always had an admiration for the folks over here at Durham EMS. There's just a resilience, there's a dedication to the community that's always drawn me to the folks that work here. And I had a lot of friends who worked over here over the years. Mm-hmm. And so when the opportunity came open for this chief paramedic position, it was a natural application, right? It was something I absolutely wanted to be part of and saw a great opportunity with the framework that already existed here. Lots of awesome opportunities to really enhance this organization.
Well, we're delighted that you decided to join us. Now, for those who may not be familiar, what does Durham County EMS do day to day? What makes our system unique?
Sure. So we are 24/7. We are in the streets running emergency medical calls for anyone who might need something in terms of emergency response. Mm-hmm. And so if you think about law enforcement responding to police-related incidents or the fire department responding to structure fires, we do the same for anyone with a medical emergency. So day to day, our folks, our paramedics, EMTs, and AEMTs on our ambulances see everything from chest pains to respiratory distress calls to cardiac arrests to car accidents, the whole gamut of what may or may not be. It seems to be that EMS is always the place that if we don't know what to do, we call EMS, and that's the police department. That's everybody, it seems like. And so we also have really unique niches within this industry. We have community paramedics that really focus on very, very specific areas, whether it's opioid addiction and recovery. Mm-hmm. We have special operations teams that support, some of our more vulnerable scenarios, special events and large-scale mass gatherings. We have teams out there on bicycles. So lots of unique opportunities within the EMS world to use the skills and expand your experience levels. But the core root of what we do every day is really guarding life, right? If you need help, if you're sick, if you need to get to the emergency department, we're the people that take you there.
Yeah, so you kind of see people on some of the worst days.
Some of the worst days.
Yeah. So how many employees work in your division?
We have 180 that currently work in the EMS division. We are part of Office of Emergency Services, so we have 4 major divisions within the department, including emergency management, the fire marshal's office, our business services, which is our fleet and logistics, and then EMS, which is the largest division, 180 staff, primarily paramedics, EMTs, and AEMTs.
Yeah. So do you think we're staffed well for a county our size?
I think that that's a question it's an interesting question. I think that Durham County EMS has not grown to match the demand that exists. And so that is something we are working on and evaluating. Ideally, we would have far more ambulances on the streets than we do today, but we have to figure out, this is not a problem that came overnight, and it's not going to fix itself overnight. So we've come up with some opportunities and scenarios and plans that we've submitted up to our leadership to try and fix that for the future. Demand grows for EMS a lot faster than simple population growth because there are a lot of other factors that drive emergency response. That includes socioeconomic changes, that includes access to health care, that includes just in general the aging population, right? There's a lot of different factors that drive our growth. And so we do not have an equal growth to simple population growth. It's actually greater. And so those are things that we try to highlight when we go into processes of what do we need to do to expand, how do we grow, where is our demand hours at, and so on.
Well, if I'm not mistaken, I think the manager's recommended budget might have an increase in there that would help you with another ambulance
Yes.
and a unit. And explain how that works.
Sure. So today we are fully staffed for probably 16 or 17 ambulances. However, we're allotted for 19. And so the challenges that we face are, our staff, we're people. People get sick. People have babies. They stay home with their children. We have workers' comp injuries. It's a dangerous job and people get hurt. And so we don't really have the backfill. So when people are out taking vacation time, recuperating, it's a mentally demanding job. And so people do need a break sometimes. We don't have the backfill to fill all those staff positions. So what we are trying to accomplish is every ambulance, every 24/7 ambulance needs an additional capacity, an over-hire capacity essentially. So in theory, 4 shifts, you would have 8 people, but really we need 10. Probably 12 in all honesty, just to have that back capacity to backfill those needs. So the idea, though, is when you look at the hours of the day, the call volume is not the same at 2 in the afternoon as it is at 2 in the morning. And so we need to peak load those trucks over those demand hours, which require actually more units because it's not a true one-to-one relationship of day to night. And so we are highlighting those. We're providing that data to the manager's office so they can provide it to the commissioners, and those decisions are made. But yes, this year we were recommended for 1 additional full unit, 24 hours a day, and 10 FTEs. And by the time we probably see this, hopefully that'll be approved.
Yeah, absolutely. What would you say are some of the biggest challenges that your EMS teams face in a growing community like ours?
I think it's twofold, right? Our folks really are customer centric. They want to be there for our residents. They care so much and so deeply. On the flip side, we have to think about our staff. And again, it is 24/7, high demand. Their utilization is very intense. So they are running calls the whole shift, and they're exposed to, you mentioned earlier, we see people on their worst day. Well, our folks are exposed to that cumulatively over and over and over. And so in a community like this, where we have a lot of growth, both population, just the general commercial growth, the demand is intense. The high volume is growing, and we need to be able to rise to that demand to meet that. And so, it requires us to do some prioritization of our call types. Unfortunately, that requires us to hold some calls. And we have to evaluate calls based off of the criticality of them. And, the ideal situation, an ideal state, nobody waits for an ambulance, but that's not the world we're in today. And so it is important for us to ensure that the sickest of the sick always have that ambulance available, but we're always going to come and be there for everybody. It's just, it may not be in that first couple of minutes. And the expectation over the years has had to shift. If you look at hospitals and the wait times, you don't just get seen next of order at a hospital. You get seen based on criticality. Well, same thing for us. And until we have a situation where we truly have an unlimited and infinite supply of ambulances and staff, which is not a realistic scenario, we have to prioritize as well and make sure that we're there for the people that absolutely 100% life or death need us, and those who can wait, and we will be there as soon as we can get there.
Yeah, absolutely. So I know that you recently celebrated EMS Week, and the commissioners issued a proclamation. I think you were there to receive it. So how did your team celebrate that observance?
So we do a couple of things. It's a really great honor year over year to be able to recognize the people that are doing the work in the streets and taking care of our community. We do a celebration every year on EMS Week where we recognize those who have had cardiac arrest saves. We recognize those who have been involved in complex calls where they've gone above and beyond. We do an award for our Medical Directors Award and Pediatric Life Save Awards. And so, it's sad that we have to have those, but on the flip side, it's great to recognize the hard work that went into those good outcomes. we ensure that our folks get the recognition that they deserve during that week. I mean, they work very hard all year, mostly unrecognized. They're there until you need them,
Right.
and then when you need them, you want them there immediately. And sometimes, that's tough for folks. And we also ensure that we have some good wellness activities. We've started working with a group of therapy dogs. So the therapy dogs are now around our stations from time to time.
Nice.
And that's an incredible opportunity for our team. They work so well.
Very good, very good. So looking ahead, what are some of your priorities for Durham County EMS over the next few years?
Sure. So we've already initiated, one of the first things that I did when I got here was evaluate the opportunity for a tiered system. And what does that mean? It's an opportunity to better utilize our resources. And so historically and exclusively, paramedic ambulance has been the only opportunity on the road in terms of what type of ambulance response and level of care we provide. But there's plenty of opportunity now where EMTs and AEMTs and the protocols that we follow can absolutely handle efficiently calls for service. And so there's opportunity for us to expand our hiring process and expand our opportunities for staffing by utilizing those resources more appropriately. And so we're actively evaluating, and we just completed a big evaluation of our data for response plans. So we're working with our fire departments and the 911 center to better capitalize on the right responses. So what type of calls absolutely need paramedics, which ones absolutely need first responders, which ones absolutely need, or can they go with EMTs or AMTs, and how many of those calls truly need red lights and sirens. And let's prioritize which ones need it. So when you hear a siren, it means that it's a real critical situation, as opposed to always hearing sirens, which can cause some complacency in the community.
Yeah.
And so we were working through the data for all of that. We looked at a 3-year period where we looked at the outcome data versus the dispatch data, rather dispatch versus outcome, and understand a little bit better about what call types need to have the right response plan. And so we're working now to get that all programmed in, and that'll help us to better utilize resources that are available within the county and better utilize the resources we have. And so that's a really exciting opportunity for us. And as we move forward, are there opportunities to expand in other areas with the community paramedic program, or potentially with modifying some of our deployment and in terms of hours of the day, peak units, and some of that does require some financial support and backing, and some of that we can do on our own internally.
Yeah, well, I just appreciate the fact that you guys do a lot of work in studying and looking at best practices in other places and, finding out ways to improve what we do here in Durham County.
Thank you. Yes.
And thanks to your leadership. And we're so grateful that you're with us.
I love being here. Thank you.
Yeah. So I know we've had a great conversation. Is there a final point you'd like to share with the public as we wrap up our conversation?
Yeah, absolutely. We want you to know that we're coming. No matter what, we are going to respond. We are going to get to you. Again, we have to do some prioritization on call types. And so we want you to know that we are going to be there for you. We are going to make sure that you have the care that you need. And we are going to evaluate that based off of the information that's coming into our 911 center. Our folks care deeply about you as the residents of Durham. They are very committed to their jobs. And I want you to understand that our folks are going to take the best care of you as possible. So with that said, we are a dedicated team. We are a force to care for our community, and we work very closely with all of our partners. Obviously we can't do this alone. We have to do this with a whole continuum of care from our non-emergency response teams that take care of folks getting to and from doctor's appointments, our critical care teams at the hospitals that bring some of the sickest patients in from other areas that are not as fortunate to have the life-saving resources that we have in Durham County, both by ground and helicopter. And then, our fire department first responders, our 911 call takers, right? It's a huge team. This is not just Durham County EMS. We are the ones doing the transports and the ambulances for emergencies, but it takes all of us to ensure that there's a whole continuity and continuum of the care spectrum.
Well, absolutely. Well, again, we're just so grateful to have you with us here in Durham, and we look forward to a long, productive career with you at the helm.
Thanks for having me.
Yes. Well, we'd like to thank you for joining us today. Be sure to follow us on our social media channels. Sign up for our weekly Durham This Week online so you can follow what's important in Durham Durham County. We'll see you next time on In Touch with Durham County. Cheers!